Here we go. Hey, everyone. Welcome back to Way to Gets Better. This is episode 49, and today's topic is cancer and mental health. Now, last episode, I spoke about receiving bags of mine, and now that memorials have taken place, I will speak I respect to my family because I love my family and I didn't want to overstep and speak on something I didn't know publicly. Who we actually just celebrated her 70th birthday in May, passed away from pancreatic cancer. It was caught too late. Unfortunately, she passed, and it was very devastating loss for our family. We would spend time with her on our annual trips to Saratoga, and she was a brilliant woman. She was an accomplished. She was a great mother, a great sister, a great daughter, and a great part of the family. She was the one that brought everyone together every year. She always took charge of the planning, and she was someone you would love yapping with. We were very like-minded in many ways. She was the epitome of someone who came from the Marinelli family. She was fierce and she had a good opinion on a lot of things. Um, she was family-oriented and took care of everyone with the best intentions. She was a caring and loving individual, and I enjoyed the stories she would tell me about my grandmother, who, by the way, she looks so much like, it's crazy. Um, it was a huge loss in our family. She was an amazing woman, and I know all of us still can't believe she's gone. This recent trip in August with the family, I was sick like 3 out of the 5 days, but the days that I was good, I will cherish my time with her. The last night before I got sick, I spent the whole family dinner just yapping away with her, and I remember at her party in May, she told me I was one of her favorite people, and I'll always cherish that sentiment coming from her. I'm gonna miss her, and my heart goes out to any of my family that listens to this, if they even listen. We all know Nancy was such a big part of our family and that void, and she left a void for those of us who loved her, and I was waiting to write this episode because I was waiting for the right time to talk about this, like I said, out of respect. And now I'm speaking on it as a way to grieve for someone that I looked up to immensely. A lot of the people in my family are accomplished people. Nancy was one of them, and I looked up to her immensely in a sense where she lived her life to the fullest. Um, she loved to travel, get together with family and friends, and she loved a good time, good food. Our family is all about the food. We're Italians. We're all about the food and good entertaining and things like that. So, we were at her memorial in Schenectady. And I just was in the back of my head, I was just thinking of her speaking to somebody in the corner or, reminiscing about the family. She should have been there. She'll be missed. And I know my dad treasured her enormously and he will miss her so much and we will all miss her. And she was one of those people who was loved by everyone she came into contact with. And my heart goes out to my cousins. They know who they are, her daughters. I'm very proud of you guys for think through something you should be having to go through. Like I said, she should still be here. It's unfortunate because cancer sucks, man. It really takes great people from us in a lifetime, and not fair. I've seen so many people leave this earth because of cancer and the devastating effects it has on the families left behind, and really lack of the to deal with it. And for the person with the cancer, as well as the people surrounding them, their caretakers or loved ones, and help them get through. In a perfect cancer wouldn't exist, and neither would mental illness or anything negative regarding mental health. But unfortunately, the sad reality is all three exist. And in this episode, I will speak about it. Not only speak about it for adults, I will speak on it in regards to all age ranges. And, let's dive in. And I will have a lot of story time on this topic. It's a very broad topic, which is another reason why I was taking a minute to really write this episode. Because also I lost my cousin and I wanted to speak on her in a respectable and honorable way, because I treasured her immensely. And I wanted to also talk about this topic in a respectable way because it's a very common issue that affects a lot of families, and I wanted to speak about it in a respectable way. So let's dive in. So, cancer significantly impacts the mental health of patients and their families, leading to increased anxiety, depression, and stress from the diagnosis, treatment, and potential reoccurrence. Patients may experience fear, grief, and body image issues, while family members often feel overwhelmed, guilty, and isolated. Financial burdens and changes in social relationships can also exacerbate these emotional difficulties. Now, for the patient, common emotional responses include depression, anxiety, constant worry, fear of cancer reoccurrence, and the sense of loss regarding their health and body. Now, the cognitive challenges, treatments like chemotherapy can lead to chemo brain, causing memory impairment and difficulty concentrating. Physical and body image issues, changes in physical function such as amputations or disfigurement can lead to loss of self-esteem and affect intimacy. Now, social and financial stress, patients may face isolation from friends or coworkers and a significant financial burdens due to medical costs and loss of income. And existential changes. A cancer diagnosis can lead to a reevaluation of life, with some patients finding new meaning through spiritual practices, while others may struggle with feelings of guilt. And now, for the family, high stress and anxiety. Family members, especially caregivers, experience significant stress and anxiety, with one study showing a heightened risk of psychiatric disorders requiring hospital care after the cancer diagnosis. Now, caregiver burden, the physical and mental toll of caring for a loved one with cancer can be overwhelming, leading to anticipatory. I'm sorry if I'm not meaning to butcher that on purpose. Ant- Anticipatory, if that's how you say it, grief and feelings of isolation. Now, family dynamics, the entire family units functioning can change with increased emotional burden and potential difficulties in family relationships and social isolation. Family members may also experience social isolation, feeling disconnected from others who don't understand their situation. Now, support and coping. Information education, understanding the treatment process and potential side effects can help manage the worry. Professional support, seeking help from a mental health professional, such as a therapist, is crucial for managing severe anxiety, depression, and symptoms of PTSD. And social support. Connecting with family, friends, and support groups can reduce feelings of isolation, provide emotional comfort, and your financial and social assistance. Addressing financial stresses and navigating changes in employment can be a vital part of coping. Now, a cancer diagnosis significantly impacts the mental health with common experiences including anxiety, distress, and depression, affecting up to one third of cancer patients. Research shows a strong link between mental health and cancer survival, as depressed patients may be less likely to adhere to treatment. Patients with Patients with cancer have an increased risk of experiencing a new episode of anxiety or depression compared to the general population, and this risk can persist long after the diagnosis. Now, the prevalence of mental health issues, psychological distress, up to three-quarters of people with cancer experience psychological distress. Depression and anxiety. Oh, my dad's phone's ringing and it's right over here. Sorry, guys. You hear my dad's phone ringing? Okay, it stopped. Depression and anxiety. Prevalence rates vary. Some studies show depression in 12 to 25% of patients and anxiety in 22 to 30% of patients. Other estimates place the prevalence of psychiatric disorders in cancer patients 30 to 40%. Comorbidity. Patients with comorbid depression and anxiety often experience lower quality of life, and the impacts and risk factors. Adherence to treatment, depression, and anxiety can lead to lower adherence to cancer patient. Excuse me, to cancer treatment plans, more missed appointments, survival rates. Studies suggest that a possible connection between mental health services and increased cancer patient survival. Now, the risk factor, precancer history. Patients with pre existing depression or anxiety have higher risk of experiencing cancer associated mood disorders, cancer type, and stage. The specific cancer and stage of disease can influence mental health, social factors, female sex, non married status, and financial stress are associated with higher risk. And then we have the comorbidities is a higher comorbidity is linked to an increased risk. Now, the long-term effects, elevated risk, survivors of all cancer types have higher risk of anxiety and depression compared to cancer-free individuals, and the persistent risk. The elevated risk continues for years after the diagnosis. though it may decrease over time. And we also have the importance of addressing mental health, integrated care. Mental health care needs to be integrated. Mental health care needs to be integrated with cancer care to improve patient outcomes. Screening and intervention. Healthcare providers should routinely screen for depression and anxiety to identify those at high risk. Now, support and treatment. Early psychiatric intervention, psychotherapy, and medication can improve mental well being and quality of life for patients. Now, we're back to story time. Now, in the 90s, I was born around before ish. I was like a old. My nana that passed when I was 12, she had breast cancer. She got a mastectomy to remove it, and ultimately she survived. Now, this month is Breast Cancer Awareness Month. So when I think of breast cancer, she comes to mind all the time. Now, every time she went to the doctor, she would tell my mom she was afraid that the doctor, what she was going for a routine checkup, tell her cancer came back or something. And, you know, so I could imagine not only having cancer did to her mental health, but getting a mastectomy as well as the anxiety that came after she was in remission. So I will tackle all of the gray areas. Now, in regards to the mastectomies and mental health, this is what the research said. A mastectomy significantly impacts mental health, potentially causing grief, depression, and body image issues. Oh, you hear my dog barking? Going nuts. There's a dog passing. I wanted to do this out in the open. You're going to hear all the noises today, guys. So let me start that over. A mastectomy significantly impacts mental health, potentially causing grief, depression, and body image issues due to cultural associations between breasts and femininity. Though breast reconstruction can help improve psychological outcomes and body image for some patients, post mastectomy mental health challenges are a normal part of recovery but can worsen if they interfere with daily life, signaling potential depression that requires professional help. When communication with a doctor, support network, and attention to mood, sleep, and appetite are crucial for managing emotional toll of a mastectomy. Now, read what it says about the emotional and psychological impacts, the grief and the loss. The process of losing one's breast can trigger grief even before surgery as one anticipates the loss. Body image disturbances. Breasts are often linked to femininity and sexuality, and their removal can lead to distress and negative self view. Changes in intimacy. Patients may feel less desirable or experience changes in their sex lives and the way they express their sexuality after a mastectomy. Depression and anxiety. Negative emotions are normal, part of recovery, but persistent sadness, loss of interest, or changes in mood, sleep, or appetite can indicate depression. Changes in identity. Losing a breast can alter a person's self perception and how they see themselves in the world. Now, factors influencing mental health. Breast reconstruction. For some, successful reconstruction can lead to improved body image, feeling of regaining their former self. Though results vary, cultural factors, societal views on breast as symbols of femininity can heighten the emotional distress associated with the mastectomy. Now, age. Younger women may find the loss of breasts more challenging as it can be more impactful to their sense of identity, future. Now, support system. A strong support network of partners, friends, and family is vital for navigating the emotional challenges after surgery. Now, what to do? Talk to your doctor. If persistent feelings of sadness, mood changes, or other symptoms of depression last for more than a couple of weeks, speak to your doctor. Lean on your support system. Share your feelings with loved ones and your broader support network for comfort and perspective. And monitor your mood. Pay attention to changes in mood, behavior, and outlook. And these can be kinds of depression issues. Hold on. Consider reconstruction. Discuss the option of breast reconstruction with your healthcare team. If you feel it would improve your sense of self and well-being, seek professional support. Mental health support can be crucial for coping with the complex emotions that arise after mastectomy. Now, in regards to mental health and the fear of the cancer coming back, this is what the research said. Because I do know my nana, she always, and as young as I was, I still understood what my mom was saying when she would vent to dad about how my nana was always scared when she would go to the doctor for a routine checkup or a physical. She'd be like, "Oh," like, she would be afraid that the cancer would come back, and that's what the doctor would tell her, and I think it's a common thing. I think you went through the cancer, you dealt with it, and now that it's over, you're still not out of the woods after a certain point. Because I think is 5, but there's always that fear that it comes research. It is very common for cancer survivors to experience fear after that their cancer will return. While some anxiety is normal, excessive FR can significantly impact mental health and quality of life. This can cause a range of issues from difficulty sleeping to post traumatic stress disorder, the cycle of fear and anxiety. For many survivors, a cancer diagnosis can and trust in their own body. It can this can lead to a vicious cycle of anxiety where harmless aches and pains are immediately interpreted as a sign of cancer returning. They call it anxiety, which anxiety levels often spike before follow-up visits or medical scans, phenomenon known as scanxiety, uh, trust of the body. Survivors may no longer trust their body and become hyper of every sensation, leading to a constant state of alert. Uncertainty is triggering. Fear of reoccurrence is often fueled by a need for but even with extensive information, patients can remain uncertain. Avoidance behaviors. Some may avoid follow-up appointments out of fear, while others engage in excessive medical checkups seeking insurance and social withdrawal. The fear can cause survivors to withdraw from social activities and loved ones, further increasing isolation and distress. Now, factors that influence fear reoccurrence: gender. Studies show that women are more likely to report higher levels of FOR than men, and age. Younger survivors tend to experience greater anxiety about recurrence simply due to concerns of unmet life goals like career or family planning. And other psychological factors: high levels of psychological distress, depression, and generalized anxiety, excuse me, oh, my nose, generalized anxiety are strongly linked to higher fear recurrence. Worse prognosis: patients with advanced cancer or less favorable prognosis may experience greater fear due to a stronger awareness of the severity of their condition. Cost of treatment create financial toxicity, a form of stress that can intensify fears about the future. And in anniversaries, the anniversary of a diagnosis or treatment milestone can trigger anxiety, bringing managing and coping with the fear. Acknowledge your fears. It is important to recognize that this fear is a normal reaction to traumatic experience. Acknowledging things rather than suppressing them is the first step. Maintain an open dialogue with health your doctor or oncology social worker about your fears and what symptoms. Follow-up care plan can give you a sense of control and empowerment. Now, seek emotional support. Share your feelings with a trusted friend, family member, or counselor. Support groups are also highly effective space to connect with other survivors who understand your concern. And focus on wellness and control. Engaging healthy lifestyle with regular exercise, a balanced diet, and a sufficient sleep can help you feel stronger and in more control of your health. Exercise, in particular, can be an excellent stress reliever. Practice mindfulness and relaxation. Activities such as meditation, yoga, deep breathing can reduce anxiety and keep you grounded in the present, preventing your thoughts from spiraling into the worst case scenarios. And challenge excuse me, that was a tongue twister. Challenge your anxious thoughts. When you experience irrational fear, practice fact checking by asking yourself if your thoughts are accurate. Remind yourself that a cough or an ache is often normal physical sensation. And consider a mental health professional. If your fear is overwhelming and it affects your daily life, talking to a therapist specializing in cancer survivorship is a powerful tool. They can teach you coping strategies such as cognitive behavioral therapy to help reframe your anxious thoughts. Cancer has a profound impact on the loved ones as well. Now, this is what the research said in regards to family members and mental health when it comes to cancer. Now, cancer profoundly impacts family members. family member mental health, often leading to increased rates of anxiety, depression, and other psychological distress due to emotional, physical, and financial burdens of the disease. Supporting these members involves open communication, providing practical assistance, connecting them with support groups, and access to professional help like cognitive behavioral therapy or mindfulness. Common mental health impacts on families: emotional distress. Family members often experience fear, stress, worry, or feelings of isolation, helplessness, mental health disorders. These show that increased risks of depression, anxiety, and other mental in parents and spouses are of of cancer. Behavioral consequences. These emotional responses can manifest as changes in energy levels, sleep problems, or difficulty concentrating. Long-term impact. Mental health challenges can persist long after treatment ends, with fears of reoccurrence or social isolation contributing to ongoing stress. Now, the factors that increase the risk: severity of illness, the type and stage of cancer, and its impact on the patient's daily life can increase family stress, caregiver burden, the processes, and toll of the are significant stressors. Financial pressure, lost income, or healthcare costs can exacerbate them, and a lack of support and feelings of isolation. Now, how to support your family members: offer open communication, create a non feelings and fears, clear them up, provide practical help, offer concrete assistance, daily chores or other tasks to lighten the load, and encourage connection. Help family members stay connected with their own social support network and encourage them to seek. Okay. Hello? Hello? Oh, this is the part. Hello? Hello, hello. Oh, here we go. Okay, guys. Okay, what is happening? Hello? Hello? Okay, here we go. We're back in business, you guys. I'm so sorry. Let me start that over because my microphone. I gotta get a new microphone as soon as I can. I'm buying myself a better quality microphone. Provide practical help. Offer concrete assistance with daily chores, groceries, or other tasks to lighten the load. Encourage connection. Help family members stay connected with their own social support network and encourage them to seek respite. Facilitate professional help. Suggest resources like support groups, therapists, use cognitive behavioral therapy, CBT, or mindfulness based interventions, and validate their experience. Acknowledge their difficult situation and let them know it's okay to feel overwhelmed. Now, I remember being there for a family friend through her husband's cancer journey. Unfortunately, he passed away last November of lung cancer. And during his battle, the amount of stress his family was under was overwhelming. And I made sure to check in any chance I could get. Make sure check in on your friends going through it, or make sure you check on the friends that are helping their loved one get through it. And it's not an easy time in their lives between the doctor's appointments, the chemo, and the stress of the unknown of the future, and the health decline in their loved ones or themselves. You know, it's not something that is relatively easy for anyone involved. So now that I've spoken a lot about the adults' cancer, let me speak about children and cancer in regards to the mental health. Now, childhood cancer significantly impacts the mental health of both the child and their family, causing emotional distress, depression, and post traumatic stress. The diagnosis brings intense emotions and can disrupt daily life, leading to fear, sadness, isolation, and disruptions to social development. And survivors may face long term challenges with mental and emotional well being, and family members, particularly mothers and fathers, also experience increased rates of mental health issues. Psychosocial care and support are crucial alongside medical treatment to help families cope with these profound effects and improve the quality of life. Now, the impact on the child, the emotional toll. Children may experience fear, sadness, anger, confusion due to the diagnosis and treatment, anxiety and trauma, painful medical procedures, hospital stays, and overall experience of life threatening illnesses can trigger anxiety and post traumatic stress. Now, social isolation. Being immunocompromised, children may have to avoid crowds and miss out on school, sports, and social activities, leading to isolation. And body image issues. Cancer treatments can lead to physical changes affecting self esteem and body image. Now, long term effects. Some survivors face ongoing mental health challenges such as depression, anxiety, and trauma symptoms that can interfere with daily functioning. Now, the impact on the loved ones, whether it's parents, siblings, or family members, this is what the research said. It said that emotional distress, parents and caregivers often face intense fear, stress, and anxiety, and grief. Increased mental health risks. Studies show higher rates of depression, anxiety, and other mental health visits among parents of children with cancer compared to the general population. And we have parental burden. The overwhelming demands of caregiving, financial strain, and disruptions to work and family life can contribute to distress. And sibling impact. Siblings can also be affected by the diagnosis, experiencing their own emotional challenges and changes in family dynamics. Now, addressing the mental health challenges, psychosocial care. Integrating mental health support with medical care is essential for addressing emotional, social, and spiritual needs. Professional support. Seeking support from a mental health professional such as pediatric psychologists can provide families with a safe space to process feelings and develop coping strategies. And supportive interventions. Basic supportive interventions, counseling and therapy can help patients, siblings, and caregivers cope with the stress of the cancer diagnosis. And community and family support. Family members and friends can provide practical help such as taking on chores, running errands, or simply offering a listening ear can alleviate some of the burden on primary caregivers. Now, here are some self care tips for both the cancer patients and caregivers. Self care for cancer patients and their loved ones involves prioritizing physical needs like sleep, nutrition, and gentle exercise, while also focusing on mental and emotional well being through activities that bring joy, stress reduction, techniques like journaling, and building a strong support network. Asking for and accepting help, setting boundaries, and connecting with others facing similar challenges are essential for everyone involved to cope with the demands of cancer diagnosis and treatment. Now, for the cancer patient, prioritize physical health, rest, aim for 7 to 9 hours of sleep, use sleep diary to identify issues, nutrition, eat a healthy, balanced diet, avoiding foods high in sugar, saturated fats, and processed items as they can increase inflammation, and movement, and engage in regular moderate exercise to boost energy, manage mood, and support physical function. Now, tend to mental and emotional needs, joyful activities. Continue or start hobbies that bring you pleasure, such as reading, listening to music, or being in nature. Emotional expression. Journaling can be a powerful outlet for processing emotions, reducing anxiety, and improving sleep and relaxation. Practice calming activities, listen to music, or spend time with pets. Now, seek support. Ask for help. Don't hesitate to ask for practical help with daily tasks like errands or meals and connect with others. Utilize online resources and support groups like the American Cancer Society's Cancer Survivor Network or to connect with others who understand. And now this is for the loved ones and the caregivers. Prioritize your well-being. Take breaks. Schedule small increments of time to yourself. Recharge, whether it's a walk, listening to music, or watching a movie. Maintain your health. Attend to your own doctor's appointments and report to any physical or emotional symptoms to your care team. Build a support system. Rely on family, friends to help with caregiving tasks for your own emotional support. And manage stress. Exercise and healthy eating habits. Incorporate exercise A healthy diet and sufficient sleep to your routines to combat fatigue and irritability, and manage body and mind, mind body techniques. Try deep breathing and other relaxation to reduce stress. Now, be an effective support. Listen actively. Show up for your loved ones with listening ear and be present without feeling the need to fill every silence. Accept help. Let people help you with practical tasks to save your own time and energy, and be realistic. Understand that everyone communicates differently and respect the patient's needs, whether they want to talk or be alone. And I recognize warning signs. Monitor depression. Watch for signs of depression in yourself, such as persistent sadness, loss of energy, or crying a lot. Seek professional help if these feelings can become overwhelming. Now, when it comes to child with cancer, here's what research said you should do in regards to their mental health. To boost a child with cancer's mental health, focus on emotional support and connection by allowing them to express feelings, maintaining routines where where possible, and involving where maintaining. Let me read that again. The way I read that. To boost a child with cancer's mental health, focus on emotional support and connection by allowing them to express feelings, maintaining routines where when possible, and involving them in decisions. Professional support is crucial. Engage child life specialists, psychologists, and social workers who can offer talk therapies like cognitive behavioral therapy and art or music therapies. Encourage continued connections with friends through video chats or phone calls, and consider therapeutic play and opportunities to participate in age appropriate tasks to foster a sense of control and usefulness. Now, encourage emotional expression and connection. Listen without judgment. Let your child talk about their fears, sadness, without trying to change. Creating new routines and maintaining existing ones can help children adjust and feel more secure. Um, Offer choices. Giving the child choices in age-appropriate situations can help them feel more in control. Connect with friends. Help your child stay in touch with friends through video calls, text, or social media. Allow visitors when the child's up to it. And now seek professional and therapeutic support. Um, Consult a specialist. Work with a child life specialist, psychologists, and social workers. Explore talk therapy. Therapies like CBT, cognitive behavioral therapists can teach effective coping strategies for anxiety and emotional regulation. And okay, I got that. Engage in therapeutic play. Play therapy can help children understand the treatment, cope with fear, and become cooperative. And consider there's other therapies. Music therapy, art therapy, and pet therapy can also provide comfort and help children process their experiences. Promote a sense of purpose. Assign age appropriate tasks. Let your child help in small ways, such as drawing pictures for you or performing simple tasks to make them feel useful and capable. Include them in decisions involving your child, and a family decision can help them feel greater sense of control during a time when much is out of their hands, and provide practical support. Explain procedures, working with the healthcare team to familiarize your child with equipment and procedures can help alleviate fear during treatment. Now, manage treatment side effects. Addressing and managing side effects can improve their physical comfort, which directly impacts their mental well-being. Now, I decided the part where I talk about the celebrities. I wanted to talk about celebrities who survived cancer because when it comes to mental health, I feel like talking about the survival of cancer will be a lot more uplifting for this topic than me talking about the people who have passed away. God rest their souls to those who have passed cancer, but I want to speak on the survivors out of the to lift people's spirits. If anybody's listening who has cancer, I want to speak on the survivors. Um, Louise Dreyfus, breast cancer diagnosis in 2017, announced she's in remission. Sheryl Crow, she was treated for breast cancer a long time, an advocate. She was a prostate cancer survivor. Sofia Vergara, she had and beat thyroid cancer in her 20s. Colby Smulders, ovarian cancer as a young adult, later survivor and mother. Michael C. Holm, treated for Hodgkin's lymphoma, later returned to Christina Applegate. She had breast cancer history, publicly shared her diagnosis and treatment, and Olivia Munn. She disclosed a cancer diagnosis and treatment in recent coverage. Now, celebrities whose children had cancer and they survived. Ryan Murphy, son Ford, was diagnosed with neuroblastoma in 2016 and later beat the disease. Um, Later beat the disease. Murphy has spoken publicly about the experience. We have Michael Strahan. Daughter Isabella was diagnosed with, I'm going to try to spell this out, medulloblastoma. Medulloblastoma and survived following treatments. Family has spoken about the recovery. Charles Esten, his young daughter Addie, was diagnosed with leukemia and had a successful treatment and survival path. We have Gunnar Peterson, publicly shared that his daughter Monroe was diagnosed with acute myeloid leukemia and treatments. Okay. We have Kathy Bates. She battled cancer multiple times, including breast cancer. Hugh Jackman. He has undergone treatment for basal cell carcinoma, urging fans to wear sunscreen. We have Olivia Newton. Oh no. Olivia Newton-John. She was diagnosed with breast cancer in 1992. She passed away recently, a few years ago. God rest her soul. I didn't want to add people who passed away. I'm sorry, but God rest her soul, Olivia Newton-John. She was in Greece. She was the light in this world, in the celebrity world. So many people loved her. Sorry that was added in there, but okay. Dolph Lundgren, the actor, fought and recovered from kidney cancer, emphasized the impact of medical advancements. Celebrities with loved ones who have cancer. Devon Still, the former football player, became an advocate after his daughter Leah was diagnosed with a rare form of cancer. And I think I read Devon Still. I just read that. And now I asked if cancer can cause mental illness, and this is what the research said. Yes, cancer can cause mental disorders, with depression and anxiety being particularly common among patients and their families. Even if they have no prior history of mental illness, the emotional toll of cancer diagnosis and treatment leads to worsening mental health conditions, underscoring the importance of seeking professional help to improve overall well-being and potential outcomes. Now, the emotional response to the diagnosis. Shock and stress of cancer diagnosis can trigger feelings of fear, sadness, anxiety, and depression. Oh my god, hold on. My foot fell asleep, you guys. Give me a second. I gotta position myself. I'm on my couch in the living room. Oh, okay, here we go. Okay, let's get back to it. Sorry. Oh, my foot was falling asleep. Physical and mental burden of treatment. Treatments like chemotherapy can cause side effects such as fogginess and lethargy, and can also contribute to feelings of isolation and distress, uncertainty, and changes in life. Patients may struggle with uncertainty about the future, fear of reoccurrence, and significant changes in their physical health and lifestyle, and social isolation. The disease and its treatment can lead to feelings of loneliness and disconnection from loved ones in the outside world. Depression is often characterized by persistent sadness and a loss of interest in activities, changes in eating and sleeping habits, and feelings of worthlessness. Anxiety, excessive worry, distress, and fear is a common reaction for cancer patients, and post-traumatic stress disorder. Some patients and survivors may experience symptoms of similar to PTSD, such as anxiety, sleep disturbances, and hypervigilance, and importance of seeking help. Improved quality of life. Addressing mental health needs can lead to a better quality of life for patients and their families. Better outcomes. There is evidence that mental health treatment can lead to improved survival rates and better management of the disease. And professional support. Mental health professionals can provide effective treatments such as psychotherapy, cognitive behavioral therapy, and medication to help manage symptoms. Now, here are some of the resources for mental health in regards to cancer. The mental health resources for people with cancer and their loved ones include professional counseling through organizations like Cancer Care and the American Cancer Society Online, and in-person support groups, and guidance from your oncology team to find local specialists. Now, here we go. Here are professional and direct support. Cancer Care offers free professional counseling, support groups, and educational workshops for patients, caregivers, and families. The American Cancer Society It provides psychosocial support, information, and resources for coping with cancer. The American Psychological Oncology Society, APOS, a professional society that offers a national hotline to help connect people with local counseling services. Oncology social workers. These professionals can offer counseling support and referrals and can be found through the cancer care team and organizations like the Association of Oncology Social Workers, some support groups and community, virtual support groups, which I actually got resources for, so I'll share that in a minute. Online groups like Cancer Care's support group offer a space where people share experiences and coping strategies. Local programs like cancer centers and hospitals may offer a specialized support groups, such as Coping with Cancer and Upstate Cancer Center. Now, National Cancer Institute, NCI, provides information on the emotional and psychological effects of cancer. The Cancer Wellness Centers offer free counseling and educational workshops to help the emotional distress from cancer diagnosis. And to find a professional, ask your care team. Your care team can suggest counselors who specialize in working with people with cancer. Check your insurance, contact your insurance provider for a list of covered professionals in your area, and use online directories. Organizations like APOS, the Association of Oncology Social Workers, and Mental Health America can help you find a local therapist. Now, here's a list of mental health resources specifically for people with cancer and their loved ones. And so we have the 988 Suicide Crisis Lifeline. Call or text 988 for free 24/7 crisis support. The NAMI helpline, which is 1-800-6264, or text helpline to 62640. The SAMHSA helpline is 1-800-662-4357. It connects you to treatment, support, and mental health resources. The cancer-specific health resources, we have Cancer Care, which is an individual and a group. For an individual and a group, it's support groups and educational resources for patients and loved ones. CancerCare.org. American Cancer Society, the offers a helpline, which is 1-800. Let me read this again. The American Cancer Society, 1-800-227-2345. The American Cancer Society hotline is 24/7. It is 1-800-227-2345. It offers emotional support, plus it gives you local counseling and support groups. The Live Strong Foundation, emotional support programs, fertility, financial navigation, and survivorship resources is livestrong.org. The Cancer Support Community, it is a free nationwide program with support groups and counseling online groups, and a helpline, which is 1-888-793-9355. The number is 1-888-793-9355. It is cancersupportcommunity.org. And the Wellness House, it offers virtual and in-person mental health support for people with cancer and their families. So here are some resources for children and their families. The St. Jude Children's Research Hospital Support Program and counseling and family-centered mental health care for children with cancer. Camp Kesem is camp and KESEM, free summer camps and year-round support for children who have parents with cancer. It's KESEM.org. Super Sibs, a part of Alex's Lemonade Stand Foundation, support for siblings with children with cancer. And the Children's Cancer Association, it offers music therapy, mentoring, and emotional support for kids with cancer and their families. You can find them at joyrx.org. And then we have complimentary wellness resources. We have Gilda's Club. It is a free community-based support for people with cancer and their families. Mindfulness apps like Headspace for Health or Calm. They have some free programs for cancer-related stress and art and music therapy programs, often available through local cancer centers and hospitals. Now here is a list. Oh, my computer, excuse me. Now here is a list of online mental health support groups for people with cancer and their loved ones. Now this was broken down by patients and caregivers and children and teens. So here we go. For people living with cancer, here are some support groups. You have a cancer support community virtual group, online support group for different cancer types and life stages. You can find them at cancersupportcommunity.org. We have cancer care online support groups, professionally led oncology social workers available for breast cancer, blood cancers, young adults, and more. It's cancercare.org/support_groups. Now we have Smart Patients, it's online peer support forum for people with cancer and caregivers, searchable by cancer type. It's smartpatients.com. And we have Immerman Angels. It's free one-on-one peer support. It matches you with a survivor who had a similar diagnosis. It's immermanangels.org. Let me spell that. IMERMAN angels.org. Now, for caregivers and loved ones, it's Cancer Caregiver Support Group. It's an online group for spouses, children, adult children, and friends supporting someone with cancer. We have the Well Spouse Association, online forum and groups for people caring for a partner with chronic illness and cancer. It's wellspouse.org. And we have AARP, Family Caregiving Community. It's a community space for caregivers, including those supporting cancer patients. It's aarp.org/caregiving/community. And then we have, for teens and children, we have Camp Chasm, at home, virtual Chasm. Free online meetups and activities for children whose parents have cancer is KESCM.org. We have Super Sibs, which is Alex's Lemonade Stand Foundation. It offers care packages, offers online sibling resources, and connects kids with support. So it's alexslemonade.org/campaign/supersibs. And then we have Stupid Cancer online meetups, virtual hangouts for adolescents and young adults, AYA. Cancer patients, survivors, and siblings. It's stupidcancer.org. We have a Children's Cancer Network. We have virtual sibling support groups, teen talks, and family sessions. Now, for everyone, we have Gilda's Gilda's Club virtual programs. It is family-friendly online support group, workshops, and community events. We have Live Strong Cancer Navigation Services. It is online phone support for patients and families. We have Cancer Hope Network, matches patients and caregivers with the trained volunteer mentors via phone or online. It's the cancerhopenetwork.org. And yeah, so we have that. Now let's get to my favorite part, is the affirmations. Now, here are some affirmations for the people with cancer. I am more than my diagnosis. I am strength, love, and hope. Each day, I honor my body and the courage it shows. I deserve compassion, rest, and healing. My journey is my own. I walk it with dignity and resilience. Even on hard days, I am surrounded by love and care. Now, this is the affirmation for the loved ones, whether partners, siblings, parents, friends. I can support without needing to fix everything. My presence and love are powerful gifts. I think I want to put that on a shirt. It's okay to feel tired and ask for help. I don't have to carry this alone. I choose patience and kindness for myself and my loved one. Hope and love guide me even in uncertainty. I like that too. I think I might put that on a shirt as well. Affirmations for children with cancer. I am brave even when I feel scared. My body is strong. I am loved no matter what. I can find moments of fun. I am loved no matter what. And I can find moments of fun, laughter, and joy each day. It's okay to rest when I need to. I am surrounded by people who care about me. Now, these are affirmations for children who have a parent or loved one with cancer. My feelings matter, and it's okay to talk about them. I am safe and loved. Even when things feel scary, I'm not alone. It's okay to laugh and play. Joy is a part of healing. And I can always ask questions and share what's in my heart. So there you go. That was my episode on cancer. I am doing this episode in honor of my cousin, Nancy. God rest her soul. She'll be very missed. And I'm also doing this episode wearing her favorite color, which was purple. So I'm wearing a Savage Fenty sweatsuit in lavender in honor of her. And yeah, so thank you guys for listening today. I hope this tackled everything. I really gave this topic my best. Now, next episode will be about bipolar disorder. I had to use my own diagnosis as episode 50 topic. I can't believe episode 50 already. Wow, I worked really hard on this podcast. Now, I don't know if it's some of you, none of you, or all of you listening, but I've worked really hard on this. This is my passion project. I hope this has made a difference. No, I'm gonna enjoy this weekend. Sunday night I'll work on the episode of Sunday night or Monday I'll work on the episode about bipolar disorder. I'm just gonna enjoy the weekend. I'm gonna go listen to The Life of a Showgirl by Taylor Swift. I'm hearing great things, but I haven't had a minute to just sit down and listen to it. I can't wait. I actually have a mental health appointment after this for my medication management, and then I have to babysit my niece. In the midst of that, I'm gonna paint a pumpkin with her. So when I have the chance, maybe tonight or tomorrow, if I have the house to myself tomorrow, I'll listen to The Life of a Showgirl, and I will speak my thoughts on it because I love Taylor. And I every time she breaks the internet with her music, so she is that girl. So if you or anyone you know is struggling, text home to 741-741, the crisis text line, for a free confidential conversation with a trained counselor any time of day. Text or call 988 or use the chat function at 988lifeline.org. 988 continues to offer support to anyone who needs it, but no longer offers specialized LGBTQ plus support. If you are looking for a special LGBTQ plus support, you can contact the Trevor Project directly, or you can call 1-866-488-7386. I'll read that again, 1-866-488-7386, or you can text the word START to 678-678, or connect online at trvr.org/get-help. And you can find more crisis resources at the Jed Foundation.org/crisis. Now, the new lifeline for the LGBTQIA given by Canada, due to it being taken away by the United States, is 1-877-330-6366. And you can call the NAMI helpline at 1-800, I think it's 1-800-950-6264. And you can text NAMI to 6 NAMI to 62640. You can text NAMI to 62640. Now, thank you guys for listening. I'll see you next time for episode 50. Always remember, this too shall pass. I love you guys. Stay well. Bye bye.